I'm Dr. Stephanie, and today I want to go over a little 5-minute hip mobility routine. I think this helps with hip pain, back pain, knee pain, but especially knee pain. When I have patients come in with knee pain, I like to start with hip mobility because if your hips don't move, then that puts a lot of extra stress on your knees, and so the goal is to get your hips moving better, and then that takes stress off of your knees and should reduce the knee pain. So I'm just going to go through this, several different exercises. You can do this if you have knee pain, or you can do this if you have hip pain or low back pain, or you can just do this to kind of loosen up in general. Okay, we're going to use a band for some things. So the first one, I'm just going to put a band around my feet, lay on my back, feet in the air, and then basically what you're going to do is just extend one leg like this. If that's super hard for you, you can start with your legs on the ground and do it this way. Just bring your knee up towards your chest. Okay, next what we're going to do is put this around our ankles, lay on your back again, and this one you can put a ball between your knees, or you can just put your hands like this. You're just going to rotate your feet out. Okay, so for both of those exercises, we're going to do about 3 sets of 10. Okay, next exercise, we're going to do some hip hurdles. So what you're going to do, you put 2 weights, 2 water bottles, whatever you have. If the weights are pretty low, so if they get easy, then you can stack something up a little bit higher. So what you're going to do is you're going to lift your leg up and over, and up and over. You don't want to rotate with it, just move your leg. Then rotate up and over, and back. So we're going to do 2 to 3 sets of 8 to 10. And then after that, we'll switch over and do the other leg. So same thing, up and over, and over, up and over. Okay, then we're going to do 2 adductor mobility exercises. So we're going to kneel on one knee and put the other foot up like this, foot kind of pointed out. Hold on to a kettlebell. You can also hold on to a dumbbell or start out with nothing. And you're just going to lean into this leg here. Just going to lean in, pause for a second, come back, and repeat that for 2 to 3 sets of 8 to 10. And then we're going to switch to the other side, and same thing. 2 to 3 sets of 8 to 10, just pausing when you get out to where you feel a good stretch. Okay, then we're going to put the kettlebell down, and you stay kneeling, and you can also kneel on a pad if you need to. You're going to put this leg straight out to the side, foot pointed forward, and we're going to put our hands on the ground, and what we're going to do is kind of just sit back. I like to put my toes on the ground with this back foot here. You're going to sit back and come forward. You're going to rotate these toes up towards the ceiling. So we're going to do this for about 2 to 3 sets of 8 to 10. And then we'll switch to the other side, same exact thing, just like this. Okay, one last exercise I'm going to have you do is the hip car. And we're going to start doing it on our hands and knees, and then I'll show you what you can do it kneeling as well. So what you're going to do is you're going to bring your leg up like this, and do this slowly. Come around here and back down. And you can go the opposite way. Come back up, around, and down. Up, around, and down. And do this for 2 to 3 sets of 8 to 10. So you can also, you can do this holding on with both hands, but I'm going to show you one so you can see me do it. So we're going to do it like this. We're going to come out to the side, up, and foot on the ground. So up, come around, and down. Up, come around, and down. You want to do it really slow and controlled.